Thank you to everyone for joining us this afternoon. We want to welcome you to Wednesday Wellness, a free live educational series by Trinity Health. We are thrilled to have you with us here this afternoon as we discuss a healthy start to pregnancy and our centering pregnancy model. Before we get started, we would like to share a few notes. Your cameras and microphones have been turned off to ensure a smooth experience. If you have questions during this presentation, please use the Q&A chat feature located near the bottom of your screen. Questions will be addressed at the end of the presentation. Lastly, today's webinar is being recorded and a link to the video will be sent to you via email. Without further ado, I am pleased to introduce Dr. Maggie Ford, a board-certified OBGYN with Trinity Health West Michigan Medical Group.
Hello, thank you everyone for joining. We're so happy to have you here. I'm going to just take a few minutes to introduce myself and Julie, who I have with me. Like she said, my name's Maggie Ford. I am a OBGYN. I've been with Trinity for 10 years. I am from Michigan. I grew up just outside of Lansing. I'm a state grad, so go green, go white. I went to Michigan State for undergrad and medical school, and I was over at Henry Ford in Detroit prior to here. We love Trinity. Like I said, I've been here for about 10 years. I have two children of my own. My husband is a nurse and a firefighter, so we stay very busy. So that's me. I'm going to let Julie introduce herself, and then I'm going to give you a little bit of background of what we're going to do today.
Hi, everyone. My name is Julie, and I'm a medical assistant here at Trinity Health. I've been with Trinity Health for about 25 years, and I am going to be a facilitator for our new centering program, and I'm very excited for this program. I think it's going to be really, really great for our patients.
So today, the mainstay of our presentation today is to talk about centering pregnancy, which is a really new, exciting, wonderful way to receive obstetric care. And we're going to go into detail about that. Hopeful to get more and more patients involved in that as we start this for our population. But before that, I just wanted to go into a little bit about what having a baby at Trinity Health looks like. We are currently situated at our downtown office. So we have 5 different offices that we offer obstetric and gynecologic care, but we're mainly talking about obstetrics today. We have an office downtown on Cherry Street, which is directly across the street from Trinity Health Grand Rapids. If you're not new to the area, you might hear it called St. Mary's, which is the olden name, and some people still call it Saints. But we are located right across from that. We also have offices in Rockford, Byron Center, Hudsonville, and over in East Paris area, and hoping to get lots of different locations to make it easier for patients to be seen at a convenient location for them. We always aim for 10 providers in our office, and we have 2 additional 10 delivering providers, and we have 2 additional mid-level providers that all do obstetrics and gynecologic care. The delivering providers are the providers that would help welcome new babies into the world and do any surgical intervention that needs to be done. We all go to different offices and all go to some of the same offices. Our office is well equipped with lots of MAs like Julie, who's been here for a long time, but also well equipped with nurses. We have nurses who answer our phones and answer all questions. They can answer about 90% of questions, and if they can't answer your question, they can get to us and we can for sure get you an answer. But they are well dedicated, well educated in obstetric care and are here for you. We also have an after hours line with nurses on it that can get a hold of the on-call physician at any point if there's any sort of emergency, but they can also provide that education for you after hours as needed. So that's a little bit about our office. Our birth center on average does about 1,800 deliveries per year. We're a fairly busy delivery center. We have 9 labor and delivery rooms that are set up purely for laboring and delivering. We have some rooms that we call flex rooms, which is just a way to describe we can use it for multiple different things if we, for whatever we need to use it for. We have 4 dedicated triage rooms, and we have 18 dedicated postpartum rooms for our patients to stay with the newborn with them. We very proud to share that our NTSV rate, which is a fancy way of saying our primary C-section rate, is well below the national average, rounding out at about 23 to 24% annually. Nationally, it's about 27 to 30%, so we're well below that, and we pride ourselves in that. We also have a very low epidural rate compared to places around the country. We anywhere from about 65 to 75% epidural rate annually, which really goes to show how wonderful our nurses on labor and delivery are at guiding you through natural labor if that's something that you desire. We most definitely have other pain options as well as epidurals, but it just goes to show how great our one-on-one labor and delivery staff is at getting you there how you want to be there and helping you through that. We have a VBAC success rate. So for those of you that don't know what VBAC is a vaginal birth after cesarean. So our office really tries to avoid that first C-section if possible. But if we have to end up in a C-section to have a healthy mom and healthy baby, we are very strong advocates of trying to do labor after cesarean. And we do have a very high VBAC success rate of 70%, which is well above the national average. So that's something we also pride ourselves in. We do have a level 3 NICU, meaning we keep all gestational age babies at our hospital. We don't have to transfer out based on age. The only time we have to separate mom and baby is if baby needs immediate surgical intervention or immediate cardiac intervention, which they would go to Helen DeVos. Otherwise, our NICU is level 3. We have neonatologists and neonatal nurse practitioners in-house, and we pride ourselves in being able to keep mom and baby together as much as possible. So that's a little bit about the birth center. So today what we're going to talk about is a new way of receiving obstetric care that's called centering pregnancy. And I'm going to go through this slideshow with you and discuss it. And we are super excited. We're starting our first centering pregnancy in September, and we can't wait for that. And we'll continue to add on more groups as we get more people educated on what centering pregnancy is, and we get more people signed up for it. There we go. So the mission of centering healthcare is to improve health, transform care, and disrupt the inequitable systems throughout the centering group care model. So this is just a picture of all the current states that are providing centering care. If you look at Michigan, you can see that we're getting there, and we're getting more and more, especially compared to other states. But I'll show you in a slide coming up. Our governor has put a lot of funding into getting centering care up and running, which has really been great for Michigan population. So you can get there's lots of different type of centering out there. So obviously we're focusing on centering pregnancy, but some people might have heard of centering newborn care. So you can actually do centering for pediatric care if your institution offers that. You can do centering for prenatal care. You can do centering for elderly care, which a lot of people may have also heard of, where they bring the elderly together to create a more of a community feel for them, which is the same thing that we're going for with pregnancy care, is getting the community together, teaching each other, getting to know people, developing relationships with each other to help each other through their pregnancy journey. The core components of any centering program is going to be a health assessment, which we'll discuss more a little bit here, but you'll have one-on-one time with the provider to ask individualized questions and to do any sort of health assessments that we need to do in private. And then there will be interactive learning. So we really centering really focuses on you learning things and helping to teach other people at the same time. So centering groups are generally very diverse with different backgrounds and different, as far as pregnancy goes, some women may have had babies before, some women may have not. And we use that to our advantage to help each other learn what to expect and what to go through and different ways of solving problems that we encounter throughout the pregnancy. And the third core component is that community building. So while we help each other learn and navigate through this journey, that helps us form relationships within the community and meeting people that are going through similar journeys as us. And centering has had a lot of feedback that these people really do develop, the patients that join centering really do develop long-term relationships with each other. So in each centering session, we meet as a group. So we have all of the patients and the facilitators. And you'll see here the facilitation team is generally speaking a provider and one of our facilitators. We try to make each group session be the same facilitation team so that we can really get to know each other. And so we set those expectations that you'll get the same group with you. This is kind of a brief outline of how things go when we start our centering. Team will arrive. We will do those individual vitals, which we'll talk about in a minute. We'll do that individual health assessment that I touched base on. Our circle up and socializing, and then circle up again is really the engaged activities that we want everyone to be involved with. We don't like to just sit and talk like I am today. We really like to have other people join us, get up and move a little bit, and really be able to take something home from each session. And then we always end with the closing. So centering in Michigan, these are all the different areas in Michigan that are currently providing centering care. And like I said, in 2023, Governor Whitmer signed a bill that brought a significant amount of funding into centering for specifically pregnancy and prenatal care programs. In 2025, we're working on up to 40 new centering programs starting in Michigan. And of note, in 2023, Michigan did actually have the lowest infant mortality rate. And it's thought to be due to the ongoing efforts of the centering pregnancy and doula initiatives. Why do we do this? Why are we putting money in this? Why are we looking at it? Because we know that there's a significant amount of deaths that happen in maternal mortality, deaths in pregnancy, even though we spend the highest percentage of money compared to other industrialized nations, we still have an extremely high maternal mortality rate. It has increased actually since 2020 by 38%, which is an alarming amount. The other aspect of why is that there's significant disparities in healthcare, especially in pregnancy. So when we look at the rate of preterm birth among Black birthing people, they had a percentage of about 14.8, which is about 50% higher than if you look at the preterm birth rate of white or Hispanic birthing people. And at a small community level like our hospital, that disparity can be even more dramatic. So centering is really looking to help with these two things. One, decrease maternal mortality, and also decrease the disparities in healthcare by bringing everyone together and getting that community experience. So when polled, when you talk to people who have done centering, I'm sorry, that's the next slide, pardon me. This is more about the medical stats. So patients who have been involved with centering have experienced 37% decreased NICU admissions compared to non-centering patients. They've had a 58% decrease risk in or reduction in preterm birth risks when compared to non-centering patients. And they've had a 63% reduction in low birth weight risks. And it's really thought to be from establishing this community group that you can create relationships with and help guide you through a healthy pregnancy journey instead of feeling like you're doing it on your own. When we talk to patients about their satisfaction rate, centering has a 96% satisfaction rate from patients. Patients that commit to the centering care really have had great results from it, both emotionally and physically. They've really enjoyed how much relationship building they've been able to do throughout the community, and how that has really changed their journey, not just during pregnancy, but also at the time of delivery. Knowing what to expect, understanding questions to ask, understanding what's normal and what's not normal, being more proactive about your own healthcare, has really given these patients a really great experience. Lots of statistics on this page. When we look at specifics of preterm birth, low birth weight, and breastfeeding, what we're looking at here is the CHI rate, which is the Centering Health Institute. So that's patients who have received centering care. You'll see that their percentages are quite significantly better than the US rate and the Michigan rate in all the categories. And so for preterm birth, you can see that patients who received centering care, their preterm birth rate was only about 6.8% compared to Michigan as a whole, and patients who didn't receive centering was as high as 10.4%. So that's a pretty significant decrease for preterm birth deliveries. Also, low birth weight, which is generally associated with preterm birth, was significantly lower in the patients that received centering care than compared to patients who received non-centering care. And then your breastfeeding goal. So the HP 2020 stands for Healthy People 2020 goal. So when we look at the benefits of breastfeeding, their goal was to get 82% of people breastfeeding. You can see that centering patients were well above that. At 86% of patients in centering felt comfortable breastfeeding and successful with breastfeeding, compared to Michigan as a whole, only at 76%. So that's a pretty significant percentage for all three of these different pillars that we looked at. I talked about how the disparities in healthcare. And so when questioned or when addressed with patients, specifically Black patients that were in centering, felt less disparities statistically significantly compared to women who did not do, or that did individual care, did not do centering care. Same actually for the Caucasian or white population. Less patients felt disparities than compared to those that did individual care. So this just really shows how centering tries to eliminate those disparities by receiving care as a group, as a whole, understanding that you're receiving the same care as the patient next to you is. So these next 8 or 9 slides, I'm going to go through individual aspects of centering and what we do throughout the sessions. So you'll see here, this is a mock picture of a centering group, and you'll see a couple things about it. One is you'll notice that everything's facing in a circle, and everything is, oh, sorry guys, hold on, our light went out. 1 second. There we go. We weren't moving around enough in our room. So you'll see the big circle group. You'll see that somebody is getting a health assessment over here. And so the point of this slide is to show that you will have individualized health assessments, but those will actually happen in a group space. And that is a big point with centering, to understand that everyone's receiving the same care. It will just be in a private area. There will be a walled off partition, similar to this. Ours is a little bit bigger to give you some privacy, but similar to this, so that we can do our individual health assessments and then we do our education as a group in the circle. So we really, with centering, we really want patients to engage in their self-care activities. So this is one of the examples, is that we will teach patients how to do their own blood pressures, and then we will let them do it throughout the pregnancy, and they will help teach other patients how to do it throughout the pregnancy. And there is so much importance in being an advocate for yourself and understanding your care that you're receiving and things that help your care, and really getting you engaged with that tends to have better long-term outcomes for patients. So each plan, when we come into a session, we will have a plan in place, but the emphasis each time will vary. So pending on the gestational age that our groups are at, we will pick different topics to go through that day, different education topics, different ideas. We do a lot of fun games. We do a lot of fun activities. And again, we really get people to engage in their own care. So in this picture, you can see we're circled up like we'll always be. When in this group, they're using some, blanking on the word, they're using some things to be involved. So maybe it's a question and answer game, and this one appears to be agree or disagree. And so you can raise your hand, and then we really want conversation to go on from there. We really want patients to be involved. We really want to hear other people's opinions so that we can get different ideas for all of the problems that we may be encountering during pregnancy. We always make sure to leave time for socializing. This is a big part of centering, is getting to develop those relationships, getting to know people in your community, getting to understand their journey as it compares to yours, and how is it similar and how is it different, and how can we relate to each other and how can we help each other. So we always make sure to leave plenty of time for socializing. Sometimes you can socialize so much that we have to cut it short, but there's always time for socializing to get to know each other. Like I've said a couple times, the groups are definitely facilitated to be interactive. These are not sessions where we want to sit here and talk to people and lecture people. We want to bring about ideas and get people thinking and talking and sharing with each other and being interactive with each other as a way to normalize all of the changes that happen during pregnancy, normalize the unknowns that come in pregnancy, and help each other through getting through all of those hurdles. So as you've seen through most of these pictures, I've said a couple times, all of the groups are conducted into a circle. We really want people to feel welcome. We want them to know that we hear them, that we see them, and we want them to be engaged with us throughout the whole session. So who's included in the centering sessions? Like I said, there will be facilitators, so that will be a provider and a facilitator with us. We encourage support people to come, and we encourage anybody that's going to be involved in your support, and we encourage them to come to the groups. We as facilitators will try our best to always be consistent, but we ask the same from you. So if you have support people that you want with you throughout pregnancy and delivery, then we would love to have them join in the centering program so that they can be just as involved in your care as you are. We try to make the groups not too small and not too big. We really aim for the group size that's optimal for interaction. So if it's too small, sometimes it can feel overwhelming that you have to talk too much or be involved too much. And if it's too big, then that leaves the opportunity for people to not be heard and to get left out. So we'll aim for 8 to 12 patients per session, or pardon me, per group. And that tends to be the most ideal to get everyone involved as much as they can be throughout the sessions. There's ongoing evaluation throughout. So even though we have a plan in play, we're going to continue to evaluate how everybody's doing, things we can continue to improve on, things that patients may want more of or less of. So even though we have those plans set in place, there's always room for variation. And we want that from people. We want them to give us feedback how things are going and what we can do better. This is a quick centering video that I'm going to play.
In the beginning of pregnancy, I feel a little bit scared, especially in my case, it wasn't a planned pregnancy. So I was a little bit scared because I wasn't informed.
It was overwhelming. This is our first baby, so there's so much to learn. There's a big learning curve.
It's been hard, but I'm not trying to get emotional. I'm sorry.
That's okay.
We struggled with infertility for a while, so like we're excited.
My first 2 pregnancies, my support system wasn't very good. And so hearing about the Centering Pregnancy program, I thought, wow, what an amazing opportunity.
The best way to describe Centering Pregnancy, it's like a support group. It's your prenatal visit and prenatal education all in one.
The Centering Pregnancy program is helping people feel more empowered at their deliveries, knowing what their choices are, and we know that it gives us much better outcomes.
The community at Centering Pregnancy, you know, it's amazing the connections that are formed here. When you go through something so isolating as a pregnancy may feel, it's really nice to have a built-in way to make new friends.
Being able to join Centering Pregnancy have been really helpful in terms of like making me feel understood and I'm not alone in this.
I think Centering Pregnancy is an extremely beneficial program. I really would love to see this become standard of care.
Let me just get back 1 second. Move my toolbar 1 second. So that was a video. That is the end of the Centering slideshow. We would love it if, obviously, if people ask questions right now, but if you have questions and you want to talk to the office, you can absolutely give our office a call. You can find our information on the Trinity Health website, Birth Center. And our nurses and staff would be more than happy to talk about centering with you and how it individually would look for you. And if it's something that you think would be beneficial for you, we would love to give us a call. Anything else? No, I don't think so. Okay, so we are open to questions if there are any questions today.
Well, wonderful. Thank you guys so much for that very informative presentation. We are going to transition to Q&A, so if anybody has not had a chance to yet, please drop your questions into that Q&A feature located near the bottom of your screen. And we do have a couple of them that I think will help us get started. You did cover a lot on the overall benefits, but what do you think is the #1 benefit of the Centering program?
I really just think it's about community and bringing everybody together, and using each other as resources. I think sometimes, like in the video, they said people can feel alone. And I think by bringing everybody together, they have a commonality. And I think just by sharing experiences, whether that be, you know, previous births, or, you know, something that, you know, family members are telling them, I really feel like the biggest benefit is just going to be bringing everybody together in a group setting and sharing their stories and asking questions and using each other as resources.
I would echo that. The only other thing I would say for the #1 is I think it just provides more opportunity to have more education. Prenatal visits, if you've had a baby before, you know they go pretty quick in the office. Our staff and ourselves provide as much education as we can, both in the room and through electronic form sharing, but it's just not the same. Sitting in a group together, having that dedicated time, the sessions are 2 hours long, and obviously some of that is the health assessment and socializing, but that leaves a lot of time for education, and I think it really is the best way to actually learn what's happening in pregnancy and what's happening to you and what's going to happen, and it's the best, it just gives the most time for actually educating you about pregnancy.
Thank you. The next question looks like it is less about the Centering program, but more about one of the stats that you shared, asking about the mortality rate and why you think there has been such an increase in such a short amount of time.
I think that a lot of things are always changing in healthcare. I think the pandemic scared a lot of people of coming into healthcare systems. And a lot of that percentage jump was in the first couple of years after the pandemic. And I think that people were not receiving the care that they needed in facilities that they needed. And I think that significantly increased the maternal mortality rate. Also, as a whole, as a society, we tend to be getting a little more unhealthy as a general public. And so that includes pregnancy. And so we are always taking into account the pre-established health issues that our patients are struggling with. And I think those are contributing to maternal mortality also.
Right, thank you. Another question that has come up is, in addition to the Centering Pregnancy program, are there other things that somebody can do to make sure they have a successful and healthy pregnancy?
Oh, absolutely. You know, the Centering Pregnant program is amazing, and we're so very excited to get that started. But, you know, when we look at just individualized care, when I see patients for annual exams and we're thinking about, you know, getting pregnant and what does that look like, you know, my main focus is how healthy can you sustain for yourself? So we don't have unrealistic goals about health. We have very realistic health goals here. You know, getting exercise 4 to 6 days a week, eating fruits and vegetables, staying hydrated. You know, what does your menstrual pattern look like, and how healthy is your ovulatory cycle? So just, you know, being as healthy as you can be before you getting pregnant is going to set you up for the best pregnancy journey and the safest outcomes for you and your baby.
Thank you. Our next question is, how many Trinity Health locations offer this program?
So currently, Trinity Health Grand Rapids does. Muskegon will be up and coming. And then Trinity Health in Ann Arbor and
Clinica Santa Maria.
Locally, Clinica Santa Maria offers centering. But then on the east side, Livonia and Ann Arbor are up and running with centering programs. So the goal with Trinity is to have all facilities doing centering program. I don't know the exact timeline, but locally right now it's Grand Rapids and Clinica Santa Maria, and the east side is up and running with it.
Thank you. This one kind of fits with that question as well.
Yeah.
It's asking, you shared a map at the beginning with the locations throughout the country. Is centering becoming more popular in West Michigan? Is Trinity Health one of the first?
It's becoming more popular in West Michigan. It's Corewell. Corewell is already doing centering pregnancy within the past year or 18 months. I don't know. I'm unaware about U of M West.
Thank you. The next question kind of goes back to what you had stated right before we went into the questions. Just asking, what, if you can remind us what office you're at again and the best way to contact.
Yes. So currently, Julie and I are actually sitting in our new centering room at our downtown office, and that's where the centering groups will be. And our phone number is 616-685-8750. And anyone that wants to call is welcome to call and talk to one of the nurses, and they can answer any questions that you have about centering and how you would fit into that, and any other questions you have about it.
Thank you. And it looks like this one might be our last question. But again, as Dr. Fork stated, if you have additional questions and you don't have a chance to drop them in the Q&A, you're welcome to call. For someone who might be a little shy, and this could be a little bit of an intimidating situation, what would your recommendation be, and how would you recommend we approach this?
I'm going to let Julie share because she's actually quite shy.
I like that the groups are they're on the smaller side. So I think that feels a little bit less intimidating. Just from actually going through the training, I think at first, sometimes you're a little bit hesitant to open up, but we've really found that like once you start sharing and other people start sharing as well, people really kind of start to open up. They start to create friendships and relationships, which I feel like makes it a little bit easier. So I think that's key, is just to kind of also be, yes, you may be shy, but just kind of willing to share, even a little bit at each session. And then really by the end, like by the end of our few days of our training, everybody was really opening up to each other, telling stories about each other. Even employees that I've worked with for a long time, we started to even learn new stuff about them too. So yes, you may be a little bit hesitant. I do like that it's on the smaller side. And just by opening up a little bit, it kind of opens the door to start sharing a little bit more. And I think then that promotes other people to start sharing more as well. So.
And I think the big thing is that that time for socialization. So there's actually snacks and food provided in each of the sessions. And so having that relaxed time where it doesn't feel like you're at a doctor's appointment and you're not rushed, you just get to relax and hang out and get to know each other. And that first half an hour when we're doing individual health assessments and the socialization time, you get to know people, and it can be a one-on-one. You don't have to immediately talk in the big group. And most patients that have said that they were also shy, just like Julie said, you know, within the first couple sessions, you start to feel relaxed. You get to know people. We're not asking you to sit here and tell your life story on day one. We're not even asking you to tell your life story throughout all the sessions. We just want some engagement. It helps the group and it helps people feel more comfortable. And I think that really does come naturally throughout the sessions.
Thank you so much. It looks like we have one more question that maybe piggybacks off of a question we had earlier. For someone who is not yet pregnant, but as you mentioned, wants to be as healthy as possible before pregnancy, should we schedule an appointment to check in with our provider?
So I always tell people it's an individual, that's an individual answer. But if you're up for it, I always say yes. I think it's great when patients come in and meet us. They get to know the facility a little bit better. They get to see some of the staff. And we can go through your med list. We can go through your surgical list. We can go through your health history list. We can talk about what supplements that we really suggest, what things to avoid. And I think it just gives people a sense of understanding of what comes next, and how can I get to that next with the least amount of hurdles in front of me.
Perfect. Thank you. That was our last question. So
Great.
I would like to thank Dr. Forg and Julie again for their presentation and the Q&A. That was wonderful. And thank you to all of our participants that joined us today. We are all set. So I hope everybody has a wonderful day.
Great. Thank you.
Thank you both.